So hello friends, so today I'm going to make a video on the topic jaundice. So now today I'm going to discuss about a definition of jaundice first of all. So here that before discussing jaundice, that you should know about the condition that so here normal serum bilirubin range. So here normal serum bilirubin range is equal to 0.1 to 1.2 milligram per deciliter, and here basically, and when serum bilirubin level exceeds 1.5 milligram per deciliter, so here in that case, so here jaundice occurs. So therefore that I think you are able to so here get a definition at least by looking at these terms. Yes, I know. So here it is simply, so here basically increase in the serum bilirubin, so here level above the, so here serum bilirubin level above the normal bilirubin range, and here, and this leads to yellowish discoloration of the body tissues. The yellowish discoloration of the body tissues, so here due to increase in the serum bilirubin, so here level above the normal bilirubin range is known as jaundice. And here, and this serum bilirubin level, that is which has risen above the normal range, it can be, so here that is unconjugated or here conjugated bilirubin both. So therefore I have written so therefore that is jaundice occurs either due to rise in both, so here conjugated bilirubin, conjugated and unconjugated bilirubin. Now I'm going to discuss the types of jaundice. So there are three types of jaundice: hemolytic jaundice, hepatic jaundice, and obstructive jaundice. So now, so first of all, I'm going to discuss about hemolytic jaundice. But before discussing the hemolytic jaundice, you should know the formation of unconjugated bilirubin. So here that you all know that, so here basically RBCs here, so here RBC which is in normal, that is biconcave disc, and then it pass in spleen, and in spleen, so here that is RBC destroyed, and this leads to formation of unconjugated bilirubin. So here I have written that RBC on passing through spleen, a destruction or a rupture of RBC done, which leads to formation of unconjugated bilirubin. And here, and as this bilirubin is water insoluble, so it is known as unconjugated bilirubin. Here also that is I have written so here basically how unconjugated bilirubin form. And yes, also that you will have to study about this also in your biochemistry also. And here, and in spleen also, that is outside the blood vessel, that is the rupture RBC done, so therefore it is extravascular hemolysis. So now you will be able to understand hemolytic jaundice. So first of all, that in normal, that is we know that, so here let that out of 4 RBCs, that is when they pass through spleen, that is all RBCs not destroyed. So here basically that some RBCs rupture and others don't rupture. So therefore that is in a normal individual, that is which does not have jaundice, that this rupture of RBC occurs in a balanced manner. But here that is in person that is with hemolytic jaundice, that you can see that when RBCs, so here pass through spleen, then here excessive destroyed. That means that out of 4 RBCs, that means out of 4 RBCs, so here yes, hemoglobin not written, so here it is just only a rough diagram, that is out of 4 RBCs, that is all the RBCs destroyed, so that means all rupture, that means excessive destruction. So therefore I have written that hemolytic jaundice occurs due to excessive destruction of RBC, and in hemolytic jaundice unconjugated bilirubin increases. So now so here basically definition of RBCs, so here jaundice given. So now that is I am going to so here teach you the so here hemolytic jaundice. So here basically it is written that in hemolytic jaundice, so here basically that is excessive red blood cells are hemolyzed so rapidly that the hepatic cells, though the excretory function of liver is normal, the hepatic cells so here simply can't excrete the bilirubin as quickly as it is formed. So therefore it occurs to excessive destruction of RBC, and therefore the plasma concentration of free bilirubin, so here the plasma concentration of free bilirubin rises above the, so here rises above the normal levels, and likewise the rate of formation of urobilinogen is greatly increased. So now I am going to explain about hepatic jaundice, but before hepatic jaundice you should know the, so you understand the transport of unconjugate bilirubin to liver, and what happens. So here basically when unconjugate bilirubin reaches the liver. So first of all, that here that is unconjugated bilirubin form, and this unconjugated bilirubin, so here basically binds with albumin, so here to form unconjugated bilirubin and albumin complex, and then this unconjugated bilirubin albumin complex then reaches the liver, and before reaching the liver, that is albumin is released, and here in this way that is unconjugated bilirubin transported to liver, and it reaches the liver. And yes, also, and about this also you will have to study in biochemistry also. Now so here basically, and in liver, that is unconjugated bilirubin is converted to bilirubin diglucuronide, basically conjugated bilirubin, and this conjugated bilirubin excreted into bile. So here, and this happens in a liver, and this is a normal situation. So here also I have written that unconjugated bilirubin binds with albumin to form albumin bilirubin complex, and in liver unconjugated bilirubin converted to conjugated bilirubin. So now about the hepatic jaundice. So here, so you can see here that I have written that in hepatic jaundice, that is liver function impaired. So therefore that is liver function. So you can see here that this so here function, that is the conversion of, so here basically unconjugated bilirubin to conjugated bilirubin not done. So therefore the required amount of conjugated bilirubin formation from unconjugated bilirubin not done. Yeah. So now I'm going to explain you about the obstructive jaundice. So here, before understanding obstructive jaundice also, you will have to understand basically how conjugated bilirubin, so here goes into the bile. So therefore you can see here that in liver unconjugated bilirubin converted to conjugated bilirubin, yes, and this conjugated bilirubin excreted into bile. So here like that, so unconjugated bilirubin converted to conjugated bilirubin, and here basically, yes, and here, and this is the pink mark that I have shown, it is the bile, and here basically, and it is the common hepatic duct, it is a common hepatic duct. If you don't know, I'm going to write this common hepatic duct, common hepatic, yes, you will study about this in anatomy also. Common hepatic duct, this is the gallbladder. So here basically through common hepatic duct, and then it goes into a bile duct, and through bile duct, so here it goes into intestine. So this is a normal. But here in case of obstructive jaundice, you can see here basically that bile secreted, but here basically a blockage occurs either in this, so here common hepatic duct, or in common bile duct. As a result that this so here basically that this bile doesn't go into intestine. So therefore that portion I've written that. So therefore obstructive jaundice occurs due to a blockage in the common hepatic duct or in common bile duct. So therefore, and one thing that I want to mention is that, so therefore that is, as the bile doesn't go into intestine, it again returns into liver. So therefore it damages, so here some hepatic cells and bile canalicula liver also. So now, and that is written, that is, so here basically in obstructive jaundice, so here caused either by obstruction of the bile ducts or by damage to hepatic cells and swelling resulting in a blockage of the rate of bilirubin formation is normal, but a bilirubin form cannot pass from the blood into the intestine. As I mentioned, the unconjugated bilirubin still enters the liver cells and becomes conjugate in the usual way, and the conjugated aided, so therefore returning, and probably by rupturing of the congested bile canalicula and directly emptying into the leaving the liver. So now that is, you should understand that what happens to conjugate bilirubin after secreting to bile. So conjugate bilirubin secreting to bile, and then ileum and colon, and then in ileum intestine, so colonic bacteria convert this conjugated bilirubin into urobilinogen, and this urobilinogen, so it is secreted in feces in the form of stercobilinogen, and also in kidneys in the form of urobilin, and this urobilin excreted in urine, so therefore yellow color. So this is the situation. Now I'm going to explain you the here basically diagnostic difference between hemolytic and obstructive jaundice. But before this, you should know about the here basically that unconjugated bilirubin water insoluble, conjugated bilirubin water soluble. So first start from here, that is both unconjugated and conjugated bilirubin is dead. So here kidneys can excrete small quantities of the highly soluble conjugated bilirubin but not the albumin bound unconjugated bilirubin. So therefore in severe obstructive jaundice, significant quantities of conjugated bilirubin appear in the urine, and this can be demonstrated simply by shaking the urine and observing the foam which turns an intense yellow. So now friends, that you have to now tell that is in what type of jaundice. So here basically the level of bilirubin increases and decreases. So you have to tell here basically whether the values of this bilirubin increase or remain normal, that is in the type of jaundice. So please take a minute and then come to solution. Okay. So first of all, that you should know that in case of hemolytic jaundice, the excretory function of the liver is not damaged. Only so here excessive destruction of RBC. So here RBC cells are hemolyzed so rapid that a hepatic cell simply can't excrete the bilirubin as quickly as it is formed. So therefore, that is in hemolytic jaundice, liver is normal. So if liver is normal, so here basically that this function is well, so therefore the conjugated bilirubin level will be normal. But do you think that is whether the unconjugated bilirubin will be normal? It is no. Why? Because that this unconjugated bilirubin, so here unconjugated bilirubin forms due to destruction of RBC. So if excessive destruction of RBC occurs, then more unconjugated bilirubin. So therefore in hemolytic jaundice, unconjugated bilirubin level increases, but conjugated bilirubin level remains normal. Now, so here in hepatic jaundice. So in hepatic jaundice, as I mentioned, that is liver function is, so here basically that is liver function impaired. So therefore the required amount of conjugate bilirubin formation from unconjugated bilirubin not done. So now that is, so here basically 5 unconjugated bilirubin. Suppose 5 unconjugated bilirubin are there. So if normal, all will be converted into conjugated bilirubin if normal. So therefore these are the 5. So here conjugated bilirubin, if the liver is normal, then all will be converted into, so here conjugated bilirubin. If the liver is damaged, so here that is if the liver is damaged, so here let that out of 5 only 3 so here basically unconjugated bilirubin converted to conjugated bilirubin. So therefore that is in this case conjugated bilirubin, and this unconjugated bilirubin again will go into the blood, and this will also go into the blood. So both will go into the blood. So therefore that is in hepatic jaundice, so here both increases. Now, so in obstructive jaundice, so here you know that, so here there is obstruction in the bile duct. If there is obstruction in the bile duct, that means unconjugated bilirubin will not be able to go into intestine and it will go into the blood. But this so here basically unconjugated bilirubin is coming in the liver because the RBC destruction is normal, so it will convert it into normal conjugated bilirubin. So therefore that is in this case it is normal, but this increases, and all these things mentioned in your book also. See friends, So here basically that serum unconjugated bilirubin, so here in hemolytic jaundice increases, but in hepatic and post-hepatic jaundice does not increase. But this serum conjugated bilirubin, so here it is does not increase in hemolytic jaundice but increases or decreases. But here that is in post-hepatic jaundice it increases. So friends, so now that is you have to see that in hemolytic jaundice, so here basically there is excessive production of, so here unconjugated bilirubin occurs, excessive production unconjugated bilirubin, but here let that is all unconjugated bilirubin will not be converted into conjugated bilirubin, but some will be converted into conjugated bilirubin. And here that is, and since liver function is normal, and this conjugated bilirubin that is will go into the bile, and this conjugated bilirubin will go into the bile, and in bile, so here basically it will be converted into urobilinogen, and here and stercobilinogen and urobilin, and this will appear in kidney, in urine. So therefore that is, it is written that urobilinogen test is positive. But in case of obstructive jaundice or like a hepatic jaundice, you should know that is the liver function is damaged, or that there is blockage in the common bile duct. So therefore that is therefore bilirubin will not be excreted into the intestine. So therefore that is negative. So friends, that is he will study in liver function test, basically in biochemistry also, that here that about some, so here that is hepatic enzyme markers, hepatic enzyme markers. So therefore these are the hepatic enzyme markers, and here basically, and so here in the case of liver disease, that the level of this, so here enzymes increases, and in case of obstruction the level of these enzymes increases. Simple, but you will study in biochemistry also, but here in physiology just have to remember. And here that is one important thing, that so here liver also produces coagulation, that is coagulation factors that which cause bleeding, that is coagulation. So here that is, you just think that if there is a defect in this collagen synthesis liver, then automatically coagulation time will increase. So therefore, and all these things also mentioned in your book also, just like that. See that you know that in case of, so here basically hemolytic jaundice, liver function is normal, so therefore coagulation test is normal. But this liver function affected in hepatic and post-hepatic jaundice, so therefore these are abnormal. And this, so here basically, and in case of hemolytic jaundice, liver function is normal, so therefore the levels of all these enzymes is normal. But in case of hemolytic and post-hepatic jaundice, this increases. So that's all. Thank you.